At the beginning of the 18th century, nursing was still seen as a low-status job, often performed by women who had few other employment opportunities. Many nurses were untrained and worked in poor conditions, with little to no formal oversight. Hospitals were often unsanitary, and nursing care was rudimentary, focusing mainly on basic needs like feeding and cleaning patients. The mid-18th century saw some gradual improvements in nursing care, largely driven by the Enlightenment and the increasing emphasis on science and reason. This period brought about a better understanding of hygiene and disease prevention. Though these ideas were slow to permeate the nursing field, hospitals began to improve their standards, and some efforts were made to provide better training for nurses. The late 18th century, particularly during the Napoleonic Wars, highlighted the need for more organized and effective nursing care. Military conflicts often led to high casualty rates, necessitating better medical and nursing services. This period saw the first inklings of more structured nursing practices, although they were still largely informal. The turning point in the development of nursing as a profession came with the Crimean War, 1853-1856, and the pioneering work of Florence Nightingale. Often called the founder of modern nursing, Nightingale revolutionized nursing during the Crimean War. She implemented strict hygiene practices, improved sanitary conditions, and introduced the concept of holistic care. Her work drastically reduced mortality rates and demonstrated the importance of trained nursing staff. In 1860, Nightingale established the Nightingale Training School for nurses at St. Thomas's Hospital in London. This was the first secular nursing school, and it set the standard for nursing education, emphasizing both theoretical knowledge and practical skills. Graduates of this school became known as Nightingale nurses and spread her principles globally. Mary Seacole was born Mary Jane Grant in Kingston, Jamaica in 1805. She was of mixed race, with a Jamaican mother of African descent, who was a traditional healer, and a Scottish father. Mary's mother ran a boarding house for soldiers, which also served as an infirmary. It was here that Mary learned nursing skills and traditional herbal remedies. She later traveled extensively, gaining medical knowledge and experience in the Caribbean, Central America, and Britain. When the Crimean War broke out in 1853, Mary Seacole traveled to London and applied to join the nursing contingent being assembled by Florence Nightingale. Despite being rejected, possibly due to racial prejudice, Seacole funded her own trip to the Crimea. In Crimea, Mary established the British Hotel near Balaclava, which was part of the British supply lines. The hotel was actually more of a clinic, where she provided care for sick and convalescent officers and soldiers. She also sold provisions and provided hot meals, creating a place of comfort and respite for the troops. Mary Seacole often went to the battlefield to provide care for wounded soldiers, earning the nickname Mother Seacole from the troops. Her hands-on approach and dedication to the well-being of soldiers, regardless of their rank, garnered deep respect and affection. Mary Seacole's knowledge of herbal medicine and her practical nursing skills were invaluable. She treated illnesses like cholera and dysentery, using her understanding of traditional and contemporary medical practices. Despite her significant contributions, Seacole faced challenges in gaining recognition during her lifetime. After the war, she returned to London where she faced financial difficulties. However, the soldiers she had cared for, and others who admired her work, helped organize the benefit concerts and fundraisers to support her. Mary Seacole's approach to nursing was holistic, integrating physical care, emotional support, and practical assistance. Her work emphasized the importance of compassionate and culturally competent care. Seacole's determination, resilience, and dedication have made her an inspirational figure, particularly for nurses from minority backgrounds. Her story challenges the traditional narrative that primarily credits Florence Nightingale with the development of modern nursing. The latter half of the 19th century saw the rapid professionalization and expansion of nursing. Professional nursing organizations began to form, such as the British Nurses Association, B&A, in 1887, which aimed to promote the interests of nurses and improve standards within the profession. Nursing schools modelled after the Nightingale system were established worldwide, including in the United States and other parts of Europe. These schools provided structured education and formalized the training process for nurses. Efforts to regulate the profession gained momentum. By the end of the century, nursing registration acts were being discussed, leading to the eventual establishment of official registers of trained nurses in the early 20th century. The late 19th century saw the emergence of public health nursing, focusing on preventive care and health education within communities. This shift broadened the scope of nursing beyond hospitals and into public health initiatives. Nursing began to diversify into specialized fields, such as psychiatric nursing, pediatric nursing, and district nursing, addressing the specific needs of different patient populations. From 1700 to 1900, nursing in Britain underwent a profound transformation. What began as a low-status, unregulated occupation evolved into a respected and organized profession. Thanks largely to the pioneering efforts of Florence Nightingale and the subsequent establishment of formal nursing education and professional standards. By the end of the 19th century, nursing had laid a strong foundation for the professional advancements that would follow in the 20th century.